Welcome everyone to another video. Today I'm going to talk about the shoulder joint, specifically the MR imaging in the setting of shoulder instability. Remember that the shoulder is intrinsically unstable due to the wide range of motion, and also we'll review some of the anatomy or the causes for that instability. For the most part, we divide shoulder instability in three causes. There's an intrinsic instability due to a loose joint, and that could be due to collagen defect or some other type of intrinsic defect that the patient might have, but that type of instability is usually asymptomatic. Then we have the traumatic instability, in which we have a anterior shoulder dislocation. Usually that's the most common dislocation. So anterior inferior shoulder dislocation, and that creates some lesions that will lead into instability. The third is the acquired type, in which we have injury of either the labrum or the inferior glenohumeral ligament, for example, and that will create instability. Talking about the inferior glenohumeral ligament, we must remember that we have three glenohumeral ligaments that are the thickest portion of the capsule, but they're really part of the joint capsule. We have the superior glenohumeral ligament, which is relatively small. We have the middle glenohumeral ligament, which might be absent in about 30% of the patients. And then we have the inferior glenohumeral ligament, which is the most important one. So what you're looking at now is a T2 weighted imaging of a right shoulder in a coronal plane. And this U structure here, or this U fiber, is a normal inferior glenohumeral ligament. So I wanted to emphasize that just so you have an idea of what the inferior glenohumeral ligament looks like. And we'll review later important lesions in which we either have injury in this area here at the humeral attachment, or we have injuries at the glenoid attachment. We also have another condition that's called adhesive capsulitis, and one of the findings, although it's not the only finding, but it's one of the findings, thickening of this inferior glenohumeral ligament, which can be seen in the setting of adhesive capsulitis. So that's it for today. I hope you enjoyed the video. Please don't forget to subscribe, and we'll keep talking more about shoulder MRI.